Okay, I'd like to open up the meeting for May 11, 2020, and in keeping with the ongoing emergency order from Government Vega to limit gatherings and maximize social distancing, and under legislation passed to address remote board meetings during the emergency declaration, this meeting will be conducted over Zoom. Attendance by the board members will be remote, and remote attendance shall count toward quorum. Tonight we have everybody here: Chris Mills, Ari Zayas, Lynn LeBlanc. The meeting will be broadcast live and recorded on ECAT. To join a remote meeting using your computer, click on the URL at the top of the meeting agenda or copy and paste it into your browser. I don't think I have to keep reading, because to join a meeting using your phone, call the number provided underneath the URL. Now, is that for the public?
Yes.
Okay.
Yep.
All right. So we do have to accept the minutes from April 13th, 2020. And then after that, the minutes for April 24th, 2020. Can we do those together, or do they have to be individually?
You can decide to vote the slate. You can accept the slate.
Okay.
All of them.
I make a motion to approve the minutes for April 13th, 2020, as well as the minutes from April 24th, 2020.
Second.
We'll make a vote by a roll call.
Zayas, aye.
Mills, aye.
LeBlanc, aye. Okay, moving on, we have no variances tonight. We do have some discussion on the novel coronavirus update. I'm sure there's a lot going on with that.
Yep. So actually today we just posted to the website that we remain at 224 cases. That is actually the result of a case being transferred out of town and another case then being transferred into town. And I'm sure what you'll notice if you look at the dashboard data that Kit had provided as part of your packet, when you look across the state, you'll see often Monday, Tuesday, or Tuesday, Wednesday, there's a slight dip or a stagnation in the number of new cases, which we all seem to think is a little bit attributed to lower visits to test sites on the weekend, possibly the lab slowing down a little bit on the weekend, because it does seem to automatically pick right back up again after that. One of the newest things that I wanted to talk to the board about and relay to the public that is going on in our battle against coronavirus is I wanted to get into a little bit the new antibody testing that we're hearing so much about. And I want to start, and I'm going to repeat probably a few times while we're having this discussion, that at this time, and again, everything changes by the minute, but at this time, the Department of Public Health is not recommending antibody testing. The reason that they're not recommending antibody testing is we have nothing to compare it to, nothing to qualify it against. Recently, they came out Friday with guidance for local health departments on what to do when we receive these antibody tests. The toughest part about this is we really still don't know what it means. We don't know how long the antibodies have been there. We don't know how many of them are needed to fight the illness. We don't know how to tell old antibodies from new antibodies. If this were measles, we have a lot of historical data. We can look at antibodies and say, yep, there's a level there, and we know they last lifelong because we have done surveillance over many years. We know how to look at mono test results and be able to tell whether or not a mono infection is an old infection that is clearing up. Unfortunately, with COVID, we don't know. So the presence of antibodies, because we cannot do anything else with that number at this time in the Commonwealth, counts and is treated as a positive COVID test. So if you were sick back in March and you decide, hey, I'm going to go get the antibody test and see if maybe I've already had it. You can get that antibody test, and if it comes back positive for antibodies, you are considered a new case of COVID. Because you didn't have a swab back in February or March, we can't anecdotally accept that as you having had COVID. And a positive antibody test will necessitate somebody being placed into isolation, their contacts being collected, and the entire house going into quarantine for the allotted period of time. The recommendation is, if you are going to have the antibody test, that you have a PCR or the nasal swab for the genetic material of the virus done at the same time. That will allow us to have the two pieces of information that allow us to say it's a current infection or it's not a current infection, and base a decision off of that. As we're getting these antibody tests in that are showing antibodies, what we are going to have to do is reach out to these people just like we would a positive case and suggest that they go get the nasal swab so that we can possibly release them from isolation sooner. But in the absence of that PCR test, they will be instructed, if they're positive for antibodies, to begin an isolation at home that lasts at least 10 days. Now they've expanded isolation. It was 3 days fever-free, symptoms resolving, 7 days since your onset. Now it's been extended as of Friday out to 10 days. So if you get an antibody test, that's day 0. The next day becomes day 1. And if it's positive, you are in isolation for 10 days, and we're doing a full contact tracing on you at that point.
And that's for everybody, not just healthcare providers, right?
That's for everybody, correct.
Could I ask you something, Kristen? Are the people that are doing these antibody tests, these doctors' offices, letting people know that so they can,
I doubt it. We have 4 that have come back positive in the past 48 hours that we will be getting in contact with. And I don't know if they are being told that that this is the end result.
May I also ask, I had a case when I was tracing where the RNA was still being shed nasally. So it was 5 weeks out, and they met the criteria to be taken out of isolation, but they just wanted to have it rechecked again, this person. It still had RNA material for the virus. Would that mean they would still be considered positive?
Mm-hmm. Yep. Yep. So that as the webinar that delivered this information to us stated, CDC could change that as of tomorrow or the next day or the next day or the next day. The more we learn, and it's a valuable tool and data that needs to be collected, it just really makes the most sense if we can partner it hand in hand with a nasal swab at the time, if the person has not previously been diagnosed. So for somebody that was diagnosed with COVID in March, had a swab, any of the cases we've been following up with, if they want to go get an antibody test, they would not be placed back into isolation, because we have the positive and we know it happened, and we can actually look at, or the data, the people in the lab can look at the 2 different types of antibodies and possibly discern some information that'll carry us forward. But for the average person thinking, well, I was really sick in February or March or April, and I just want to go find out if I've had it already. The positive antibody test isn't that simple that it means that you had it and it's resolved. It means you've had it, but you might have it as of today. So we have to treat those individuals as if they were actively having a case of COVID. So that's my public service announcement out there, and just to also let you guys know, if you start hearing from people that they were contacted and they didn't understand why they were being contacted or why we're not yet reflecting them in our case number. We're waiting for some clarification on the state on that, because that could send our numbers into kind of a spike that really isn't, we're not sure what it would mean. So it might actually come to a point where, because these two different types are coming in, the probables and the confirms, maybe we need to just step back from actually posting a daily number. But I don't think we're quite there yet.
You would think there'd be a way on the software to differentiate the two.
There is.
Oh.
I can run a report that gives me both of them separate, as opposed, or I can run a report that gives them to us combined.
But the problem is you still have to follow up with them.
They'll have to follow up on them. Yep. And there's not a clear indication right now as to whether or not the CTC, which has been working quite well for us right now, that's the program that the governor unveiled where they were hiring contact tracers. That does seem to be working. The cases are flowing over into Maven. We're just starting to get information back. That does seem to be working, but there's some conflicting information as to whether or not they will also accept these cases. So we'll work that out as the week goes on.
Whew. Okay. It's always something.
Yeah, it's always something. When it comes to your mask order, as you know, the mask order went into effect, and then right after we took action, the governor took action, and his is a little bit more sweeping. We have been spending a lot of time and energy out in the community. Mark and Tim have been to a lot of businesses. They've been following up on a number of complaints, and in an attempt to educate individuals. Although we are starting to see some repeat complaints from businesses. So I've asked town council to look into, what is available to the board as far as enforcement. And there are a number of different ways to go at it. I don't think we're quite there yet. I think we still need, a little bit more time for education, signs. I think in general, the public will, somebody has music playing.
I'm sorry. Hang on one second. That's my husband singing.
Just mute. I'll just mute Lynn.
Hey, Gary, your voice is beautiful, but everybody.
Oh my God. Look, Gary.
There's a lot of different options available. Cease and desist orders, fines of $300. We can get into criminal complaints. We can also get into, they're looking into for me.
Kristen,
I muted myself. I meant to unmute Lynn. They're also looking into whether or not what would be involved with us suspending food licenses, the permitted places. So town council is coming up with some answers on that for us. And there we go. My family just had to shut the door so we don't hear them.
I didn't think you could hear him. Sorry.
So again, while we're on camera, I do want to thank the majority of our businesses out there for implementing the board's order, and more recently following along with the governor's orders. Both orders do acknowledge that some people, either because of their age or because of medical conditions, may not be able to wear a face mask. The governor's office did come out with an actual list of conditions: people who can't breathe safely, people who, due to behavioral diagnoses, may be unable to have their face covered. It may cause a high level of anxiety for some people. Those who communicate and rely on other people being able to read their lips, people that require supplemental oxygen, again, we hope these vulnerable people are able to find others that can go out on some of the errands and the shopping type of things, and those exercising outdoors. The governor specifically called out that those who are exercising outdoors and are able to keep the safe physical distance don't need to have a face covering on when they're running alone down the road. So I'm going to paraphrase something that the director of health down here in Rhode Island said that I think really set a nice tone to this. And what she basically said is that, you know, we need to acknowledge when we make some of these wide sweeping policies that there are always going to be exceptions. And like I tell my children, you never know what's going on in somebody else's home or in their life. So you really kind of have to take a step back sometimes. And patrons should not be asked to document these issues. For some people, these are very private things that they may have gone through or are dealing with. And these members of our community should be embraced and not treated with anger and rudeness, but should be taken at their word while we continue to encourage all those who can wear a face covering to do so. I thought she just had a really nice way of putting, we're in this all together. And at some point there will be a herd immunity, and the more people that are wearing masks, you know, are out there protecting those that possibly can't wear them because of medical reasons. That was that page. They have changed the testing protocol a little bit. Used to be if you were a contact, they were saying wait till you had symptoms to get tested. Now they're saying go ahead and get tested and see what happens. So they're opening up that avenue as well for people who are deemed to be close contacts of positives. That is about all I have on COVID, other than the governor today gave a little teaser as to what the plan will, or what the framework will be that the plan coming out on Monday will be introduced into. The town also has a committee working on the long-term opening plans. So stay tuned. I don't think anything's going to be a fast and furious race back to normalcy or what we thought was normalcy. But we will continue to be represented in these discussions, and I will continue to keep you guys in the loop as things come together.
Thank you.
Thank you, Kristen. I had to unmute myself. My family's noisy tonight. I did have a quick question somebody asked me, and I feel like I know the answer, but while somebody's waiting for their test to come back positive, family members have asked, should I just go get tested too? Now, in the past, I followed the CDC criteria when I did the tracing, and you kind of waited. But people are wanting to run out. I say, well, if you want to, you can. But if you're asymptomatic and the person that is still waiting for their test to come back, I'm not sure what sense there is to go do that.
So the memo that actually just came out today is saying that no longer do they need to wait to develop symptoms. I would say, yes, Lynn, that you still want to wait for the first person to be positive.
Okay.
But as soon as there's a positive in your household, in your close work environment, in your other environment where you would be dubbed a close contact, as of today, the state is saying go ahead and get tested as soon as you hear that you have been deemed as a close contact.
Okay.
So that's a change, and that's as of today. These things are changing by the minute. They opened actually the discussion on Friday about the antibody tests. They said by Monday we may have something completely different from CDC, but as of right now, we don't, and we're going to go with what they said on Friday, which is that positive antibody test is going to be treated as a positive COVID test. So,
All right. Thank you.
Mhm.
So moving on to the next item, arborvirus, tick-borne, and mosquito-borne illnesses.
So we got word today from Bristol County Mosquito Control that they are getting ready to begin the second, much smaller targeted application, really gearing into a specific area where the larvae that are the main vector of this tend to, or where they believe and where they've documented they are. Because of the weather, it looks like it's been delayed, and their target date now is Wednesday. I have asked Mark Taylor to look into, as many of you know, historically, Mark has every spring worked with the teachers at Richardson Olmsted and done a presentation to the fourth graders there on tick-borne illnesses. It's a piece that the state had given to us because we were utilizing it. They actually gave us our own kit called Bite Lab. And what we're going to look at is possibly having Mark videotaped doing his normal presentation, and a way of actually getting that out to the fourth graders, whether it's through their teacher providing a link through ECAT, whether it's us getting it up on our website and them having a link, whether it's the teacher prefers a Zoom format. But Mark's going to start working on that tomorrow and see if we can just, keep things we normally do. We're just going to keep trying to do them just in a different and socially distant way. There still should be a part of what the fourth graders get. So we're going to do our best to hopefully get Mark in front of the fourth graders and go from there.
Sounds good. All right. So, Mark, is there anything else you want to add or anything?
No, Kristen covered it very thoroughly. Thanks.
Okay. All right. We're going to move on to Betterment Applications. We have 5. The first one is 42 Caroline Road. And I think it's on page, there's some really good graphs on here, I see. It's on our page 23.
Yes.
24,
So,
excuse me.
all right. So the homeowner included in the packet, you should see a couple of quotes that they received from installers. This system is a raised system with pump. They're obviously in failure. There's wetlands as part of this. So this one's pricey, $53,453 is what they're seeking.
And is everything itemized on here, stuff that actually, really has to be done?
Yes, if you look at the, just the installation of the system is $45,000, almost $500.
I see that, yeah.
Yeah, so it's a very large system. 560 yards of sand, which is the most expensive part.
Oh, wow.
That's a lot of septic sand.
Yes. And this was done via sieve analysis because the water table is so high, had to be sent out to a lab. So.
Okay. Anybody have any questions on this Betterment application? Does anybody want to make a motion?
Yep, I'll make a motion to approve the Betterment application for 42 Caroline Road.
Second,
Okay, we'll vote by a roll call.
Zeiss, aye.
Mills eye.
LeBlanc, aye. Okay, and then we'll move on to our second Betterment application, which is for, moving down, hang on, 9 Kimberly Drive.
Yes, so we have yet to do the perk test, which is as you know, is the starting point for the new septic system. So they're just seeking the traditional $30,000 approval. Again, if it comes in under, they're only invoiced. The loan is only for the signed invoiced amounts. But we're doing the perk test May 26th out there, and we'll go from there. Hopefully they don't need any additional funds. But they're including the cost of engineering into the loan right away.
Okay. Does anybody want to make a motion?
I make a motion to approve the betterment application for 9 Kimberly Drive.
Second,
Okay, a roll call vote.
Zias, aye.
Mills, I.
LeBlanc, aye. All right, so now we'll get on to our third one, which is 2 Summer Street.
Yes, so this application, the plans have been received. Again, this is another situation, very high water table. Requires a pump system. It actually is going to have a retaining wall out on the corner of Summer and Center Street. There's wetlands in the back, so everything needs to be pumped around. It'll be to the right of their driveway. And I believe quotes were included in this as well.
Yeah.
Great. I make a motion to approve the betterment application for 2 Summer Street.
Second,
Vote by a roll call.
Zias, aye. Mills,
Mills, I.
LeBlanc, aye. Okay, 2 big ones. Now we're going on to 21 Shagback Road. They're asking for additional monies. We already voted
Oh.
for.
They've come before the board actually twice. They've did the initial 30,000, then they asked for 10,000 more, but now they're receiving quotes from installers that are exceeding that, and they're seeking an additional 20,000. So this is going to be, as of right now, he showed a couple of different quotes. He is asking for a little bit of a cushion in case they hit ledge, but he has 3 quotes and they're in the $55,000 range, including the engineering. So he's got a quote for $43,900 for the construction of one, $35,168 for another bid for construction, and $38,650 was another bid for construction, plus the engineering of $8,904. So depending on which contractor he goes with, he's already looking at, if he goes with the most expensive, is $55,000.
So 55,000 total.
Well, he's seeking 60. You can, all the bids always put a caveat in there if they run into ledge or a large boulder or something like that, that would require further expense to get that out, get it removed. That would be an additional expense on it and be added into the loan.
Okay.
He has yet to determine exactly who he's going to go with. A lot of the contractors are very busy right now, but he's obviously in failure too. So he's trying to find the contractor that can do it the quickest. A lot of the contractors are out a few months now with construction.
Okay.
And you feel
But
like
all of the bids are going over what he was okayed for 40.
Okay.
Okay.
Any questions, board?
and all of this money that they're requesting, it's absolutely necessary, correct? I mean, there's nothing that could be shaved off of the estimates to make it more reasonable. It's just based on.
It's based upon the design of the engineer, and 2 of the quotes are fairly close, and one, is between the cheapest and the most expensive at $8,000.
Does anybody want to make a motion?
I make a motion to approve the betterment application for 21 Shagbark Drive of an increase of $20,000.
I second the motion.
Vote by a roll call.
Zias, aye.
Mills, I.
LeBlanc, aye. These are expensive. Are these in areas of where the water tables are higher than others, or is it the time of year? Like, what's going on?
A pump system
No.
is always going to be more money.
Huh?
A pump system is always going to be more money anyways. And then if you have retaining walls or just from a construction standpoint, that's usually more money.
It also has to do with how much natural material they have to take out and then purchase sand to replace. With the high water table, they're purchasing the sand to bring the bottom of the septic system up. So there's a lot of factors that go into perk rate gives you the size this way, which, you know, depending on the perk rate can make it bigger this way. And every bigger piece, whether it's higher above the water table or bigger this way, is sand that they're buying. And, you know, the higher you are, the more pump
Yeah.
type of pieces. There might be electrical work. The panel might not be able to handle the pump.
And these all involve wetlands also. They're all three of them are close to the wetlands.
Interesting. All right, thank you. The next one, and I think the last one is, I think it says 19 Heritage Drive in Easton.
Yes, so the homeowners seeking the standard $30,000. We conducted the perk test 2 weeks ago. The plans have not been submitted as of yet, so he is just looking for the place card, 30,000 at this point. Hopefully, it comes in under that.
This one looks, there's no quote, but, oh yes.
Not, but no, you can't get a quote until you have the engineer.
Okay. All right, would anybody like to make a motion on this one?
I'll make a motion to approve the betterment application for 19 Heritage Drive.
I second.
Vote by a roll call.
Zai, aye.
Mills, aye.
LeBlanc, aye. So that brings us back to see what's up on the agenda. I think it was, after that, was there anything from the inspectors, the agents?
Ooh.
I think Kristen pretty well covered it. What we've mostly been doing is going out on complaints and looking at those. So.
Mhm.
Yeah, we've also, this week has seen, again, just that loosening a little bit, that some of the brick and mortar stores that were originally not able to operate because the goods they were selling were not considered essential, were given a little bit of leeway to start doing some of those, to reopen, to fulfill online and phone orders. So we've taken the governor's conditions associated with that. We've turned it into basically an affidavit type checklist. And so we're asking businesses to just complete that, acknowledging all the steps and all the pieces that are involved with complying to do that. And then we have something for our records. So there were some outreach on those. You know, we have been getting complaints periodically for different businesses and people wanting explanation as to why this can't operate, but this can. We also, I'm sure a lot of people are thankful, on Friday found out that golf courses could reopen as well, but still same thing. They had a number of conditions, so we were able to quickly take that checklist / affidavit and tailor it to the golf courses. It really draws their attention to a lot of the little things in the list, that tee times need to be 15 minutes apart. People need to, it needs to be a touchless exchange as far as money. And then again, just when we thought we had it perfect, Friday afternoon, I think, or Saturday morning, they came out and said, yes, you could have golf carts under certain conditions.
Really?
So, yep, it's changing. They kind of got a little, I think, pushback from some individuals who are just not physically able to get around the golf course without a golf cart. So a ruling came, or an advisory came out saying under the Americans with Disabilities Act that carts could be provided. And then there were a couple more steps for who could sanitize the carts and things like that. But
Is it a one person per cot kind of thing, or?
it doesn't say that, believe it or not. I read it a couple of times. Tim, did you? I was looking for that and I don't see that in there. Did you?
It doesn't state one or two people. It doesn't state it at all.
So
Interesting.
I think in order to keep the game moving, you kind of need to let the whole party move along at the same pace rather than somebody trying to walk and keep up. But not a golfer. I'm just theorizing.
We could have a little convoy with 4 carts. I'm just saying. All right. So is there anything else? No? All
I
right.
got nothing.
No?
We're all anxiously waiting for the information that will come out on the 18th in the form of a report that hopefully will give us a little bit more guidance as to what's ahead in the coming weeks and months, as far as having things start back up again, having some seasonal things happen, and we'll go from there.
Okay. Well, thank you. Thanks, everyone. I'd like to make a motion to adjourn the meeting. What time is it? We don't have to make a motion. I can just adjourn it.
Now you make a motion to
You make a
adjourn.
motion. To
6:30.
adjourn the meetings at 6:36.
Second. Bless you.
Roll call.
Roll call vote.
Zias, aye.
Mills, I.
LeBlanc, aye. All right, guys. Thank you.
Thank
Thank
you. Oh,
you.
Kit, did you have a question? Sorry.
Me?
I did
Kit?
wanted to remind regarding the roll call. That's all for
Okay.
the last vote. All right.
Awesome.
Thank you.
Thank you.
Welcome.
All right. Bye, guys.
Aye.
Bye.
Bye.